Hello, it's a pleasure to meet you. My name is Ana Claudia. I work in the Foreign Trade Department at TDV Dental. I'm here to thank you for joining us in this event today, TDV Connection. We are using this new format to share with you our latest launches. We will have here a brief presentation from our technical consultant, Dr. Rafaela Zinelli, who is also part of TDV team, and she supports us with international trainings, ministering classes, and sharing experience with students. Before giving the words to Dr. Rafaela, I'd like to make also a brief presentation of the company. So, TDV is a dental manufacturer located in the city of Pomerode, Santa Catarina State, which is located in the region of South Brazil. With 32 years of history, in 2014, TDV became part of Septodont Group, a world leader in the manufacture of injectable anesthetics for dentistry. Another important acquisition for the group in Brazil was the company DLA Pharma in 2016, located in Catanduva, a city in the interior of São Paulo, also an anesthetic factory. Dr. Rafaela?
Hello, Ana.
Hello, Dr. Rafaela. Welcome. So now I pass the words to you to share the presentation.
Thank you very much. Hello. Nice to meet you too. I will share my screen with you. Just a second, please. Well, I'm here today to present to you two new products of TDV line. The first of them is fiberglass. Fiberglass, as the name says, are burs made of fiberglass to remove cements, resins, and stain from the dental surface, from the enamel surface. So as you can see, the product is, the tip is attached with the mandrel, so it's an unique product. Is to be attached on the low speed equipment. And the indications of this product is remove cement and resin residues from tooth enamel, removes extrinsic enamel stains from coffee, from tobacco, and to make the finishing and polishing procedures too. The main features of fiberglass is that, as I said before, is composed by fiberglass and epoxy resin. The product has a controlled abrasiveness and is safe to be used on the enamel. It's available in 6 different shapes and is to be used as a low speed, always under refrigerator to avoid the warmth of the dental structure. And it's autoclavable, can be reusable. So this is a good thing because it's very economic too. The main benefits of fiberglass is that it's safe, as I said to you, to preserve the integrity of dental enamel, ceramic prosthetic elements, and soft tissues. Has an abrasive and polishing effect and can be used in orthodontics, periodontics, dentistry, prosthetics, and general practice. Each burr has a different function. They can be used to all these indications, but depends of the shape of the burr. We can use more to one indication or another. For example, the burr number 1 is more indicated to removal of tartar and extrinsic stains, Burr number 2 is to make the cleaning of prosthetical sleeve, for example. Burr number 3 can be used to make the finishing and polishing of coarse and resin restoration in lingual or palate of anterior teeth too. Smoothing of root cementum. Burr number 4 to removal of excess in adhesive cementation after the light cure. So when the cement stays hard, it's possible to remove this excess with the burr number 4. Burr number 5 is excellent to remove the resin after the bracteal removal. So after the orthodontic treatment, sometimes it stays some resin on the tooth surface. So it's wonderful, this burr, to remove this resin from the surface. Burr number 6 is more indicated to finishing occlusal and lingual of buccal posterior restoration. The commercial presentation of this product is a kit with the 6 burrs of all of the shapes here, or the unit package of your choose. Okay, now we will go to another product that is called Resinlay Pattern Photo. That is a new concept in acrylic resins. So I like very much to begin this presentation asking to you about the pattern resin. So I believe that you know what is a pattern resin, but what is it for? So the traditional pattern resins, uh, they are an acrylic resin. They were developed especially for making patterns for casting. They are self-curing, presented as a powder and a liquid in a head color. The resin heats during the cure procedure, and contracts after the cure. Generally, they have these features. So they are presented like this, like a powder and a liquid. We have to mix it then, and after this we have a product be to be self-cured. Okay, after some minutes they stay hard and ready, but we have to wait during this time. So some indications of these traditional acrylic resins, for example, to make the impression of posts that will be that will become metal after the lab procedure, copings, an infrastructure for the crowds, for example. So generally they mold or print what will become a metal, or they can be used in the union transfers union, for example, to make the infrastructure of prostheses or another indications. We have some market examples of this kind of acrylic resins that you can see from Bosworth pattern, from GC, Duralay, or even the Resinlay speed pattern from TDV. That they are of this presentation, powder and liquid. So TDV launched a new product that can be used to replace these traditional acrylic resins that is called Resinlay pattern photo. It's a light curing universal modeling resin. So this is the main differential of this product, that is light curing. Um, so this gives to the dentist more practicity in the during the procedures. Resinlay pattern photo is presented in two versions. The gel, as you can see here, is in this consistency and it has to be applied with these tips. So it's like it's not equal a flow resin, but it's more thixotropy. So it's a gel very easy to use and to put in position and stay in position. So it's ready and easy to apply, ready for use. Thixotropy does not heat during the light curing. Is light curing. I think that this is the main benefit of this product. Change the color, indicating the end of the polymerization process. So this color change is visual, so it's easy to know how it's okay, the light cure, but the recommendation is 20 seconds, okay, and leaves no residue after burning, and promotes greater agility when compared to wax or another acrylic resins, the traditional ones. The main specialties that use this product is prosthesis, implants, dentistry, and general clinic. So let's see the indications. In the implant prosthesis area, we can make the copy of the emergency profile for implants for the direct technique. Here is an example. You put the product between the transfer and the gingival tissue and light cure. And here we have impression of the copy of emergency. Here is an indirect technique of the same procedure, copy of the emergency profile. So you can see here is Resinlay gel. Transfer union. So when we have more than 2 implants, it's necessary to make this union to these transfers during the impression. So it's possible, it's compatible with any material of this transfer. Here is PEEK, here is metal, so it's possible to be used with any kind of material. Spot for welding. Here is another example, another indication. When the implant bar comes from the lab, for example, and is necessary to cut to a better adaptation, and the dentist sometimes has to make a union of this bar to send to the lab again to make the spot. So it's possible put Resinlay here and proceed to the light cure and send to the lab again. And there is another version that is a paste. So it's the same product, but here we have another consistency. And the paste, as you can see, it's possible to mold with our hands. So to make, for example, a little ball or a stream when is necessary. And the features is ready for use, easy to apply, does not heat as the gel, it's light curing, change the color indicating the end of the polymerization process, leaves no residue after burning, greater agility when compared to another traditional products as wax or acrylic resins. So the directions of the paste when we compare to gel is to make larger works. Its plasticity and density facilitate handling procedures that require greater resistance, and the paste can be used in association with gel. And here is some clinical examples of use of the paste version. Union transverse union, okay, is just make the union, can be used with if a spatula of resin or with our hands, okay, and just light cure. Bite register is another indication. It's very used in this indication, so it's necessary to make an isolation of the teeth that you doesn't need to get stuck, for example, in the another teeth. So you make an isolation and make a little ball, and we ask to the patient make occlusion here to bite and light cure, and it's ready, the bite register. So very easy and fast. Lucia's jig is another procedure. It's common in the rehabilitation prosthesis. So we make of the same way of the bite register. So it's easy to make. Here I will show you a little video showing this application. Here you can see the consistency of the paste. And so we will ask to the patient bite. Okay, another indication is to make guides for correct insertion of provisional crowns, for example. Here is a guide. And in association of techniques, we can use both gel and paste, depends of the technique. For example, to make the intracanal impression of post for the direct technique. So here is a model, but it's exemplifying a clinical procedure. So we make an isolation, internal isolation of the canal of the conduit. So we make a stain with the paste that is like a guide, okay, light cure. And this guide we prove inside the canal. So after this, we remove the guide because it's just a guide that will stay after this together with gel. And we fill this canal part of the conduit part here with the gel, okay. After this, we put again the stain made of paste inside the canal and light cure. So after the light curing, we will be ready the impression, the internal impression of post. So it's very easy, very fast. Okay, here the recommended is 60 seconds because we are light curing across the candle, so we need more time of light cure. Okay, but as the product is a little transparent, it's possible that the light will across all the product. Okay, because of the translucence of Resinlay. So here you can see the result. So after this, we just finished the procedure, uh, making this part of the post, okay, the part of the crown, and is ready to go to the lab to become a metal piece, for example. This is nowadays we have another kind of fiberglass blocks. I don't know if you know, but it's possible to be done with this technique too. Is another kind of here is a clinical, is the same procedure, just to you see. Here is the candle, and we made a stain of made of paste, make an isolation of the root here, the internal part of root. We fill this part with gel, and after this we put the stain made of paste. Okay, here is the final result of the piece. Is the intraoral proof. So this piece will go to the lab, and after this will become a metal piece, a metal post. Okay. The transfer union can be done with both in association. So here is a step-by-step how this procedure is done. So the recommended is put around the transfer the Resinlay pattern photo gel, light cure, and after this we make this union with the paste, okay, and step by step this will become ready in a few minutes. Okay, very easy, very practical. Just light cure, it's done. And the laboratory lab indication to the prosthetic technician is indicated to making of specimen for implants structure, copings, or veneers. Okay. Here we have a video showing procedure of implant structure made from a technician, a lab technician. So in this video, you will see that he used light cured oven because it's common in the lab, in the labs. Okay, but the product can be light cure of any light cure equipment. Well, the commercial presentation is a syringe. The gel version is a syringe with 3 grams and 3 applicators tips. And the paste version is a syringe with 3 grams. So, thank you very much for the attention. And if you have any question, you can send me by email or WhatsApp. That will be a pleasure to answer you. Thank you very much.
Thank you very much, Dr. Rafaela, for the presentation. I'd like to take this opportunity to inform you all that the products presented here are already available. So if you have any questions, require more details about the products, about the fiberglass, about Resinlay pattern photo, please contact us. So thank you very much for your participation, and we are at your disposal. Thank you very much.
Thank you. Bye bye.